Hello, my name is Joe Lesher, Account Manager with Centennial Medical Solutions, and I would like to invite you to join me as we explore the 411 on OBGYN and Amnion, a gift from nature. Let's begin. Number 1. What is amnion and where does it come from? Amnion comes from the amniotic membrane, an avascular and translucent thin membrane forming a closed sac that surrounds the fetus and contains amniotic fluid, which is a protective cushion of liquid that surrounds the fetus and facilitates the exchange of nutrients, water, and biochemicals between mother and child. Amnion-derived treatments have been documented in wound care and repair for over 100 years. Amniotic treatments are a natural alternative to synthetic, cadaveric, and animal-derived wound coverings. Amnion tissue is the building blocks for tissue regeneration that lends itself to wound healing and tissue repair. It's anti-inflammatory, antibacterial, and anti-angiogenic. A true gift from nature. There are between 80 and 120 growth factors in amnion. Growth factors do just that. They help the baby grow strong and healthy. Growth factors are proteins that not only have a positive effect on bone and tissue by stimulating cellular growth, but they also help in proliferation, healing, and so much more. Hyaluronic acid acts as a cushion and/or lubrication in the joints and other tissues of the body. Think of it as like the body's own motor oil. Collagen is made up of key structural proteins that ensure the cohesion, elasticity, and regeneration of our connective tissues, including skin, tendons, ligaments, cartilage, and bone. Cytokines are a large group of proteins and peptides of signaling molecules that mediate and regulate anti-inflammatory properties. Mesenchymal cells come from the umbilical cord tissue, or Wharton's jelly, and amniotic fluid. They can differentiate into other types of cells in the body, such as bone, cartilage, muscular, neurological, and skin. Number 2. How is amniotic tissue and fluid obtained? Amnion is obtained when the mother undergoes a healthy planned birth by cesarean section with no harm coming to the baby, at which point the mother is consented and compensated. The birth tissue and fluids are collected and then harvested in accordance with FDA guidelines. All tissue must meet the standards of the American Association of Tissue Banks, when it is then processed and sterilized by an FDA-approved lab. After it is tested to ensure that it is free from infectious diseases like HIV, hepatitis, and syphilis. A quick review. How do we go from a birth to an amniograft? By collecting the discarded amniotic material or afterbirth, we process the amniotic fluid, the amniotic tissue, and the umbilical cord, all into an allograft biological band-aid. Number 3. Different types of amnion products. While there are numerous types of amnion-derived products, let's focus on the two most common: liquid amnion and the amniograft and discs. Both of these products are highly versatile with powerful healing properties. They are non-steroidal, easy and safe to handle, have a long storage or shelf life, and the dry grafts conveniently rehydrate within the wound site. Amniotic tissue allografts form a physical overlay to protect wounds in vivo. Its ease of use and storage, low risk of rejection, affordability, and availability make an effective way for OBGYNs to cover and protect surgical wounds. Amnion-derived allografts can be used in surgery where the natural protective covering of blood vessels, nerves, and muscles are compromised. Adhesion barrier. Medical implant of an amnion product can reduce abnormal internal scarring or adhesion by separating the internal tissue and organs while they heal. Number 4. What are the benefits of Amnion products? Forget the Band-Aid treatments of the past. Regenerative medicine now combines repair with long-term relief. Amnion is what is known as a immunologically privileged material. This simply means it has a very low risk of infection or rejection, making it very safe. Amnion products offer a quicker and less painful recovery while offering a less expensive alternative to risky surgeries. Post-respective pelvic and abdominal adhesions may form as a result of repairs made during female surgeries. Human amniotic membranes provide a protective barrier over the wound to help prevent adhesions from forming. Amniotic tissue helps to deny infections the ability to take hold. It does this by having anti-fibrotic, inflammatory, and infectious properties, and provides an extracellular matrix useful in wound repair. Number 5. What are some of the medical uses of Amnion? Amnion-derived products are used in pain management, orthopedics, internal medicine, family practice, plastic surgery, neurology, podiatry, urology, gynecology, neurosurgery, and much, much more. Amnion is used for such common treatments as all types of arthritis, sports injuries, overuse injuries, such as rotator cuffs, Achilles tendons, joints, elbows, and knees, all types of wound care, acute or chronic, cartilage defects, meniscus tears, ligaments, and tendons. Outstanding results for Amnion specifically for OBGYN. C-sections, hysterectomies, bowel adhesions, VSO endometriosis. Human amniotic tissue allografts can help patients in the following. By reducing the formation of postoperative scar tissue at the surgical site, helps to prevent adhesions. Amnion reduces the potential for postoperative complications associated with scar tissue formation. Amnion reduces tethering of the adhesion and the tensity of the residual scar tissue that does form in the epidural space. Let's look at the conclusions of OBGYN and Amnion. It's safe and effective, no steroids, easy to use, and it has over 100 years of medical history. Long-lasting results, a natural alternative to grafts derived from synthetics or animals. Numerous peer-reviewed studies showing over an 80% success rate. The bottom line is, it works. This has been the 411 on OBGYN and Amnion. For additional information, I can be reached at 970-691-5038 or email me at joelesher@revogenbio.com or visit our website at centennialmedicalsolutions.com. There you will find product information and videos, TED Talks, medical articles, and peer-reviewed studies. Thanks for joining me. My name is Joe Lesher. We'll be back soon with more videos.